America's public enemy number one in the United States is drug abuse. In order to fight and defeat this enemy, it is necessary to wage a new all-out offensive. This will be a worldwide offensive.
And when it comes to drugs and alcohol, just say no.
Just say no.
With drug policy, we need to realise insanity is doing the same thing over and over again and expecting a different result.
It's time for us to really examine what we're doing and to use evidence. At the moment, a lot of our policies are based on ideology, not evidence.
We are now at the point where the frontline drug dealers, certainly for heroin and crack cocaine in the United Kingdom, are children.
Now, heroin, by nature, is a pain reliever. Those people using heroin shouldn't be asked about what drug they're using. They should be asked what pain they're in, because that use, that drug use, is self-medicating pain, significant pain. Why would anyone put themselves through that voluntarily?
Many of the people that I see at our legal surgeries every week have experienced some form of childhood or adult trauma that includes bereavement, physical or sexual abuse, relationship breakdown, homelessness, low income, no income. All of those scenarios lead to someone perhaps wanting to use drugs in an effort to escape, so they don't have to think about their reality just for a short period of time. That's all a very rational response to those kind of life experiences, and without a support network you can understand why someone might start using drugs and or alcohol.
I was obviously reacting to a very difficult childhood of illness that nearly killed me many times, difficult family circumstances, socially, economically, stressed out mother, absent father, and drugs are a great comfort. So having another punisher, as it were, with the police, although, I'm sure that most of them don't even want to do it, but it is their job, what's the point?
So the British drug policy is based on the idea that if you create laws that prohibit the production, importation, sale and possession of certain substances, then you can reduce the levels of harms related to those problems by reducing their levels of use. Unfortunately, that theory has been challenged many times, not just in this country, but around the world.
There is absolutely no evidence that proves any causal link between how repressive a drug policy regime is in a country towards drug consumption or towards people who use drugs and the levels or prevalence of drug use in that country.
The government themselves recognised this. In 2014, their International Comparators report determined that there was no correlation between the law enforcement approach that a country took and the level of drug use in that country.
The reason that I don't support the criminalisation of drug users anymore is because my own experience is that it had very little positive impact on whether I used or didn't use, right? So the harms I did to myself, actually in retrospect, they were increased after the police involvement. Sitting in a police station eating roaches, the filters of joints was probably quite dangerous, but we felt we had to do it in order to stop ourselves getting time in prison.
At the moment, the policies that we have make using drugs criminal, and it makes people very reluctant to seek help. And it makes it harder for us to put help in places where people most need it.
The correlation that does exist is where there are highly repressive or punitive measures towards people who use drugs, there's likely to be a very high level of harm. So, for example, repressive measures such as criminalising people for using drugs hampering access to harm reduction services such as needle and syringe programs, means that you will have high levels of HIV, hepatitis C infection and other bloodborne infections amongst people who inject drugs. You're also likely to have very high rates of drug overdose.
We don't want to criminalise people, particularly young people, and ruin their life chances. It messes up their employment, their future education, their future prospects. And actually throwing people into prison is not necessarily the best way of solving the problem, particularly with high use of drugs in prison as well.
In 2001, Portugal decriminalized the possession for personal usage of all illicit substances. Basically, we downgraded it from a criminal offense and into an administrative offense, and what that allowed us was to divert this sort of population from the criminal system and into the healthcare system. What we do basically is we assess the risk level of the user and do some sort of referral according to that assessment.
The Drug Science Journal, Drug Science Policy and Laws, recently published a 15-year follow-up on the first 15 years of the Portuguese policy. And in that time, because they've treated heroin addicts as people with an illness rather than as criminals, they have reduced deaths from heroin to 1/3 of what they were when they started. Decriminalisation is not endorsing drug use, it's merely pointing out that when people use drugs, two things can happen. They can become addicted to drugs, in which case they've developed a mental illness, and it's therefore completely appropriate and sensible to treat the illness. But the majority of people who use drugs don't become dependent and therefore are not mentally ill. These people's lives will be much more damaged by a criminal sanction, a criminal record, than by allowing them to continue to use drugs.
So the public have mixed views on drugs and sometimes hypocritical views. So I often think of conversations I've had with friends in the pub where they've got a pint of beer in one hand and a cigarette in the other, and they're railing against the people who have problems with illegal drugs. Actually, for us, we believe that alcohol and tobacco are in the same class as many of these other illegal drugs. So the Royal Society for Public Health, along with the Faculty of Public Health, made a decision back in 2016 to review our policy on drugs. We're calling for, amongst other things, decriminalisation of personal use and possession of drugs. We're doing this in part because we recognise that the harms from drug use are increasing. And we also know from our research that only 1 in 4 members of the public think that the current drug policy is actually working. RSPH, along with many other esteemed health bodies, the House of Commons Select Committee, and other royal colleges, including the Royal College of Physicians, and the media, most notably the Times newspaper, now support a review of our current drugs policy.
If we knew that that was working, we'd be able to see a couple of really important things. The first thing that we'd probably notice is that the price of drugs on the street would be going up because supply would be restricted. And that isn't what we've seen. We've seen year on year the price of drugs on the street staying the same or going down, and that's been the case for decades now. And organised crime gangs are making a killing, literally doing this.
If you consider Peel's principle number 9, Robert Peel set out how policing should function in 9 principles. His 9th principle is that the evidence of police success should be the absence of crime, not evidence of the police carrying out work. So where police arrest drug dealers or they seize a huge amounts of drugs, or where the Royal Navy does or the National Crime Agency seizes all of these big blocks of cocaine or whatever, that's evidence of police activity. It's not an evidence of reduced crime, because police never reduce the size of the market. Crime is not caused by criminals, it's caused by opportunity. And the biggest opportunity for crime in our history is the prohibition of drugs. Up until the end of the 1960s, if you had a problem with heroin, you went to the doctor, you got it prescribed. It was called the British system. At the time when the British system ended, there were 1,049 heroin consumers in the UK. 20 years later, that went up to 300,000. Before organised crime had control of the market, there was no incentive for anyone to find new customers. Annually, the National Crime Agency publish a document which is called the Strategic Assessment into Organised Crime. And in one of those assessments recently, in recent years, they made it clear that the value, the money from the illicit drugs market is the biggest part of organised crime. There's nothing else comes close to it in terms of the value of both national and international criminality. But there's also an important observation they made, that the money from the illicit drugs market is reinvested into other forms of criminality, into people trafficking, into counterfeiting, into other forms of organised violence and intimidation, and, in many parts of the world, terrorism. If we want to beat organised crime, or at least level the playing field, we need to take away their bank.
We need to consider the idea of legal regulation, particularly so that when people buy certain substances and take them, they know exactly what they're taking, they dose them correctly, they know that the supply is safe and not adulterated.
A free market legalised model might have other forms of harm associated with increasing levels of use, and especially of heavy use of substances that can be problematic. So I would argue that we need to find a middle road in drug policy between the extremes of harsh prohibition on the one hand and a free market on the other.
If we had a regulated supply of drugs, we would be able to regulate the marketing of those drugs as well. What I would suggest would be really crucial is making sure that it is illegal for those companies to advertise their products to people, because what we really don't want is to create a huge commercial industry that is able to make a lot of money out of selling drugs.
Harm reduction refers to the policy and programs that you can have in place to reduce the negative legal, health or social implications of drug use. And regardless of where you are in your regulation or your criminalisation of drugs, harm reduction is going to be critical. We couldn't possibly think that as a society we could block all drug use. So it's about going out and helping people with their decisions, making sure they're informed to the best ability possible to make the right choices for themselves. And if a person chooses to use drugs, we should be able to provide the equipment and the information and the wraparound support to enable that person to stay healthy. The amount of money you can invest in these preventive mechanisms, you save at multiple levels down the track. Needle and syringe programs have been proven over the decades to prevent hepatitis C and HIV, and the prevention, the investment you make in providing sterile commodities prevents a person being on medicine for the remainder of their life or expensive treatment programs.
I think it is time to support our partners in health and try new things, and also to look at things in a different perspective for the individuals that are drug dependent, drug users, most especially their health and well-being. I know, like policing cuts have hit the public sector widely, and that has also resulted in the reduction in services provided to drug users.
In 2016, the Advisory Council on the Misuse of Drugs recommended a range of measures to reduce opioid-related deaths. The government said it accepted most of those recommendations, but hasn't actually taken those actions, including the recommendation that we made to maintain investment in opioid substitution treatment has not been kept to. Those levels of funding have been cut by more than a quarter since 2016.
So another vital tool for harm reduction is naloxone. Now this is an antidote for an opiate overdose. This can recover someone from an overdose very quickly. This is a sealed packet. It contains 5 doses within 1 syringe. Drug users may use in company. However, if one person overdoses, then the other person might not hang around because of the way enforcement produces a fear of arrest. So if that person overdoses, his mate might bugger off because he doesn't want to be nicked for that incident. What we really want is a change in approach that encourages that person to at least ring 999 for an ambulance and administer naloxone. That's a life-saving intervention. So it's really crucial that we widen the availability of naloxone.
We should have drug testing. We should do what the Dutch do, which we have a network of testing facilities in hospitals or universities around the country that people can find out what they're taking. And that not only protects them from inadvertently taking a drug which is not what they expected or stronger than they expected, but it also gives the government a great deal of warning about the introduction of new kinds of drugs which could be very harmful. So they can warn people about those kind of things.
You know, and when we talk about drug checking, we're talking about checking for substances that are of particularly high purity, which could be dangerous to people, or substances that have something in them that people weren't expected, impurities, so to speak. And those are the type of things that can be pretty harmful to your health or cause fatal overdose. Of course, a critical part of drug checking as part of harm reduction services is really not just going in and having a transaction where you understand the content of the substance you're looking at. It's also about understanding more about harm reduction methods generally. It's about putting precautions in place and sharing information with that person. So, for example, you know, one of the key aspects of harm reduction is you might choose to take a half or a third of the amount of the drug you have initially to test its impact upon your body. And learning other things like ensuring you're keeping hydrated, ensuring your friends are looking out for you, other ways to keep you safe in broad and sensible terms. Heroin-assisted therapy is available in 6 countries in Europe and in Canada. And we know that for a certain population of drug users who have tried methadone, may have tried buprenorphine, and the standard treatments don't work, that heroin-assisted therapy is a really effective way. And the research and the studies show that it improves adherence, it improves somebody's ability to stay on that treatment.
Putting aside the absolute harm reduction benefits for the moment, from a policing-only perspective, it's evidenced that the top 10% heaviest using group for heroin, illicit heroin, actually consume 50 to 66% of all the street illicit heroin. So hypothetically, if you prescribed heroin, diamorphine in this case, which is exactly the same substance as women in childbirth are given, but it attracts a lot less stigma than heroin-assisted treatment to heroin addiction does. If you prescribed diamorphine to that user group, you could eliminate a significant portion of the organised criminality in that area. It is also proven to reduce harm significantly and also reduce drug use overall and also reduce other drug use, so crack, cocaine too. It's clearly a win-win.
A drug consumption room is a facility where drug users, most of them homeless, come to use their drug under supervision of professional staff. The goals of all the drug consumption rooms around the world are the same. We are talking here about saving lives in terms of prevention of drug-related death, of what we call commonly overdose, raising the quality of life of the drug users and the neighborhood by trying to limit the impact of the drug use in the neighborhood.
So DCRs, or drug consumption rooms, they attract another layer of stigma in the public eye, sadly. Now, DCRs are life-saving, safe spaces for people to take their own drugs. And I know that's a monumental subject for some people to get their heads around. And I don't mean that disrespectfully, because clearly drugs are against the law, and actually we're providing a safe space for people to inject. However, in the context of, record numbers of drug-related deaths, significant homelessness and vulnerability within marginalised and hidden communities, surely the right thing to do is to enable a medical facility, a safe space, to attract those most disengaged from all services into that safe space to inject drugs initially, but then providing a golden opportunity for that person to re-engage into treatment or to seek support for their homelessness or bloodborne viruses or wound care or a range of medical needs. So it's not just a safe space to inject drugs, it's a golden epicenter of support.
There is overwhelming evidence that it works, and we have in many situations great evaluations. However, we in the Netherlands never did that because for us it's very evident that it works. It would be like to prove that to jump out of a plane with a parachute would be even safer than without.
The Home Office says that they don't support drug consumption rooms and they would be breaking the law for those to be introduced. It is correct that there are offences that may be committed in terms of someone who is using a drug consumption room or those who are managing those sorts of facilities. However, it's really simple for this to be able to be dealt with by way of CPS guidance in terms of it not being in the public interest to prosecute people who are either attending that service or who are working within those facilities, and also local police guidance.
Around the world, there are 12 countries that have drug consumption rooms operating legally in their jurisdiction. And in all of those 12 countries and all of those sites, I think there's more than 120 actual sites around the world, there's never been a fatal overdose. So we know drug consumption rooms work.
For too long, we've allowed ourselves to be carried away by ideology or by our gut instinct, which is that drugs are bad. People have been taking various different illicit substances for decades for millennia, and we really need to be able to accept that fact and to try and do it in a way that causes the least harm possible.
It's quite clear to me from a policing perspective, having spent many, many years trying to solve this problem, this is not a policing issue. In fact, police were well and truly stitched up with drug policy. This is not a problem that can be solved by the criminal justice system. This is a health issue.
What we need to do in this country is to use evidence, to actually use the evidence which has been collected by many countries over many years, put best practice into place, and we would see a radical improvement in drug policy and a radical reduction in the harms of drugs.